Hi, my name is Dr. Spencer Zimmerman. What is functional medicine? Functional medicine is a term that has rapidly started to increase over the past 10 to 20 years, but really specifically in the last 5 to 10 years. There's a lot of providers out there calling themselves functional medicine providers. Now, these could be medical doctors, nurse practitioners, physical assistants, chiropractors, acupuncturists, even you've got massage therapists in some cases are calling themselves that, and nutritionists, and really the list goes on and on and on. So it's almost being used as a catch-all. But what do people mean when they say functional medicine? Now, it's important to understand what it is and what it's not, and who you should really be seeing. Now, when you hear of this, you're probably gonna think of, oh, that's like natural medicine, like a naturopath or holistic medicine. Well, that's kind of true. That's not necessarily fully true. So, as someone who's trained in both traditional as well as complementary medicine, in my training in traditional medicine, when someone comes into me with an issue, I would run tests and then I would give them a prescription or recommend further management from another provider or even surgery as a way to help them with that issue. So for example, let's say you're a type 2 diabetic and you came into me underneath my traditional medicine training. Here's how it would look. You'd come in, I would check your labs. I would say, hey, you're diabetic. Here are the medications I need you to take. And that would really be about the extent of it. Functional medicine is much different. It's a mindset. It's not a profession, but it's a mindset and approach to health. With functional medicine, it's a relationship between the provider as well as the patient. It's a teamwork. It's about identifying what is going on that's caused the issue and to address those things. So even though you may be a type 2 diabetic, the question is, why are you a type 2 diabetic? Is it simply because of the food you're eating? Or is it much more complex than that? So yes, we would do labs to identify those factors that not only about your blood sugar and everything else, but we would look and say, but what's going on? Why are you having issues with utilizing your glucose? And why is your insulin having issues? And we would address those factors. Now, that may include things such as changing the way you eat, exercising, sleep habits, controlling stress, environmental chemicals and toxins. And there's even more things beyond that that would be looked at. But that is the functional medicine approach. It's what is really causing this, and let's address that. Instead of giving you a medication and having you go on your way after a 5-minute office visit, this is an extensive office visit where there's a lot of education provided, because ultimately it is your health. And we are here to help coach and guide you to where you want to be. But we cannot replace your individual responsibility to get that health. So that is what functional medicine is. Now make sure when you find a functional medicine provider, you know someone who really does understand it and just isn't simply calling themselves one because it's good for marketing, but one who has the appropriate tools to order the right labs, who can meet you where you are and provide the full spectrum of care you need. Because while most functional medicine providers do not like medications, it's important that, because most of the people I see are on medications, you see someone who has the ability to prescribe medications. Because even if they are not going to put you on one, which most typically are not, as you get healthier, and those are the factors are being addressed to get you healthier, you may be on too much medication and you need someone who could help get you off them appropriately. And so I feel it's important that the functional medicine provider you should see has a license to do that and isn't only doing things to make you healthier. We can also help get you off medications that may be causing side effects that you no longer need because you've taken control of your health and have reduced the cause of that issue. So you've reduced the cause of your type 2 diabetes and you don't need the medication anymore. Not because you just hopped off it inappropriately, but because your lifestyle and all those factors have been addressed and your blood sugar has got to where it needs to be on its own through that approach that was taken.